Okay. Hello, everyone. Thank you all so much for coming and welcome to this special alumni event, One Health, Interconnected Solutions for a Healthy Australia. It's hosted by the Alumni Relations team at the University of Melbourne and presented by the Australian Institute of Infectious Disease. And it's just lovely to see so many people here, and we know that we're also joined by a large number of people who've registered online. My name's Professor Jodie McVernon. I'm the Director of Epidemiology at the Peter Doherty Institute for Infection and Immunity. And I would like to begin our proceedings by acknowledging the traditional owners of the unceded land that we're here meeting on today, the Wurundjeri Woi-wurrung people. The University also acknowledges and is grateful to the traditional owners, elders and knowledge holders of all Indigenous nations and clans who've been instrumental in our reconciliation journey. We recognise the unique place held by Aboriginal and Torres Strait Islander peoples as the first scientists and the original owners and custodians of the lands and waterways across the Australian continent, with histories of continuous connection dating back more than 60,000 years. We also acknowledge their enduring cultural practices of caring for country. One Health is not a new concept. We pay respect to elders past, present and future and acknowledge the importance of Indigenous knowledge in the Academy. As a community of researchers, teachers, professional staff and students, we are privileged to work and learn every day with Indigenous colleagues and partners. Before I introduce this wonderful expert panel sitting next to me, I'm first going to take a moment to discuss the Australian Institute for Infectious Diseases, or AIID, which is presenting tonight's event. And I'm going to trust that slides will miraculously appear behind us in beautiful succession. So the AIID, as we'll call it for short, will bring together some of the nation's greatest scientific and medical research minds in a cutting-edge, purpose-built facility to provide a rapid, coordinated response to current and future infectious diseases, pandemics and global health challenges. Learning from COVID-19, the AIID will strengthen our capability to respond and protect by unifying our efforts, providing access to state-of-the-art infrastructure and technologies, pioneering public health and increasing engagement with industry. It will house researchers and staff members from AIID Foundation partners, the University of Melbourne, Doherty Institute and Burnett Institute, as well as biotech industry partners. Together, these leading organisations will collaborate to enhance Australia's capability in infectious disease research, education and public health, protecting Australian, regional and global communities. It will be a centre for groundbreaking innovation, equipping the brightest minds with the best technology and resources available, creating an environment that supports breakthrough, discoveries and advancements. And by integrating our institutional expertise across epidemiology, pathogen genomics, data analytics and clinical trials, just to name a few, the AIID will drive the discovery of new diagnostics, vaccines, technologies and public health interventions to find solutions to current and future disease threats. Importantly, the AIID's programs will feature and support diverse, marginalised and at-risk communities to ensure no one is left behind in the fight against infectious diseases. Construction on this significant project will commence in 2025, just a few hundred metres south of the Kenneth Myer building on the Haymarket roundabout, well, adjacent to the Haymarket roundabout, in the heart of the new Melbourne Biomedical Precinct. It's been made possible through the support of the Victorian Government as major supporting partner, who've committed $400 million, and the foundation partners who are contributing a further $150 million towards the facility. If you would like to learn more about AIID, there are links to further information on the screen. For audiences joining in person, we also have a display with further information in the foyer. So I'd encourage you to visit that following the discussion and join us for some networking after the event. Now, it is my pleasure to introduce the expert panel members who'll be exploring One Health with me tonight, and they've been hand-selected as a great, diverse pool of experts. So firstly, Professor Catherine Bowen is Professor of Climate, Environment and Global Health in the Melbourne School of Population and Global Health and Deputy Director of Melbourne Climate Futures at the University of Melbourne. She's Director of the newly formed University of Melbourne Climate Collaborative Action for Transformative Change in Health and Healthcare Lab. Thank you, Catherine. Otherwise known as the Climate Catch Lab. Catherine is a leading, internationally recognised expert on the science and policy of sustainability, particularly climate change and global health issues. Next to her is Associate Professor Suma Majumdar, He is Chief Health Officer for COVID and Health Emergencies at the Burnett Institute. Suman is a public health leader, infectious disease physician and researcher with experience in global public health in multiple settings. Dr. Alicia Arnott is Deputy Head of Epidemiology at VIDRL, or the Victorian Infectious Disease Reference Laboratory. She's a genomic epidemiologist with extensive experience in the analysis and interpretation of pathogen genomics data to inform public health action, which was a rapidly emerging discipline during the COVID pandemic.
Yes, it was.
And finally, Dr. Sandra Steele is a Senior Lecturer of Veterinary Epidemiology and One Health at the Melbourne Veterinary School here at the University of Melbourne. Her main research interests focus on preparedness and response to zoonoses and emerging infectious diseases, exploring pathways and barriers to operationalisation of One Health in Australia and regionally within the context of One Health systems. So I think you'll agree they have an amazing breadth of expertise. Will you please welcome our panel? Before we jump into the discussion, I just have a couple of final notes. We will be recording today's session and we'll circulate it via email to people who've registered following the event. We would love to hear from you and we'll have some time for questions at the end of the discussion. And many thanks to those who've already submitted questions when you registered. And I'll be being fed live questions throughout the event. If you're watching our event live, please do submit them. We'll do our best to answer as many of them as we can later in the session, but I can tell you we've already had a number submitted even in advance, which is great to have that level of engagement already. All right, so before we start the panel, I thought we would just introduce a few of the key concepts. And really, in thinking about this concept of One Health, one of the ways that I like to introduce it to people comes from a roundtable workshop that was hosted by the World Health Organization in 2022. So clearly we'd had an extraordinary couple of years in 2020, 2021. The sort of most acute crisis phase, if you like, of COVID had passed. Vaccines were available. Societies were sort of re-establishing. The world was reopening. But at that point in time, a group of experts was brought together to say, well, where are we going next? And what are the drivers and determinants of where we go next? And I don't expect you to read everything on these scenarios, but they basically came up with sort of 4 potential scenarios that were each possible or probable, that basically ranged from happy days where, you know, COVID was under control, everybody was cooperating nicely, things were settling down, nations formed a treaty to help share things and have access to healthcare and good information. Climate change mitigation measures were working. The world is working as one. So, yeah, this is your sort of ultimate happy days scenario. But then through a series of different scenarios, it went all the way to, you know, here comes trouble, where another pandemic emerges. We have multiple viruses. Some vaccines are working, but others are not. So there are sort of virus and intervention determinants. But then we're starting to see, you know, different diseases emerging in different parts of the world. We're unable to keep track of things with technology and surveillance. Healthcare systems are in peril. There's low resilience. Health inequality is escalating. Intersectional inequality is escalating. Economic situations are getting worse. Tackling the climate emergency has gone to the bottom of the barrel. So, you know, other drivers of these sorts of infectious diseases are getting worse. And essentially there's a breakdown of collaboration and cooperation. And these other scenarios are there in the middle. But this was a global health agency saying, where's this virus pandemic going? But you can already see that the determinants of the next phase of the human experience go well beyond viruses and healthcare interventions. They're really looking at all of these other really important drivers about systems and equity and cooperation and collaboration and economies, and whether or not we're actually able to focus on and address the root determinants of a lot of the current problems that we're facing, or whether we can only just about respond to what's in front of us. So it was really exquisitely a demonstration of the fact that these pandemics emerge in a very complex, multi-sectoral way. And if we go to the next slide, what came out of this consultation was a document called the Strengthening the Global Architecture for Health Emergency Prevention, Preparedness, Response and Resilience. We call this the HEPA framework. But in that framework, really the sort of shaping, overarching determinants or objectives really focused around the need for equity, inclusivity and coherence at the centre of preparedness and response activities, with strong attention to governance, systems and financing. These are whole of society, whole of government issues. And then within that context, you can enable and implement the so-called 5 Cs of health emergency preparedness response, with emergency coordination bringing together collaborative surveillance, community protection, safe and scalable care and access to countermeasures and vaccines and other things. So all these things over here are kind of happening in the health system, but they have to take place in an enabling environment. So it was already, these global pandemic documents are recognising the importance of this whole of society action. And at the same time, on the next slide, the quadripartite and One Health high-level expert panel reframed the definition of One Health. And One Health is a term that's been around for a very long time, and there have been various branches and subdivisions of planetary health and eco-health and all sorts of other things. But I think what was very useful about this definition at this time was that this panel of experts brought together all of those elements into an interconnected framework that recognised the importance of animal, human and environmental health, that we live in an interconnected ecosystem, that all of that needs to be integrated for all of us to be healthy, but also this is all in the context of our society. So back to those broader issues of equity, inclusivity, governance, what is happening in our rural and urban communities, what's happening at national and subnational level, is there inclusivity, equity and access? We saw from COVID that where inequity existed, it was amplified. And so really seeing all of these systems interconnected and the need for communication, collaboration, coordination and capacity building towards these One Health objectives of healthy ecosystems, healthy humans and healthy animals. So that's kind of the framing conversation of, why this is rising to prominence as in the sort of global emerging infection response and pandemic thinking. I'm going to go back to those 4 scenarios, or a simplified version of them in a minute, but all of this was stimulated by COVID, but we have not past the period of danger. So I'm sure you're all aware we've seen JEV and Mpox and a whole range of things. At the moment, one of the greatest sort of global concerns is highly pathogenic avian influenza, which starts with wild birds, has been affecting agricultural animals, including poultry, large outbreaks in dairy cattle in the United States. It's affecting cats, domestic cats in Poland, barn cats in the US. We've seen unprecedented destruction in wildlife populations, and this has gone all the way down to Antarctica. There have been mass outbreaks in sea lions and other wildlife in South America. These are just sort of documenting some of the examples, but so far Australia's been spared this particular strain of highly pathogenic avian influenza, but we need to be anticipating and we need to be prepared. And as you can see, this is something that affects all aspects of humans and animals on our planet. So that's just saying this is not a done deal, this is still a current threat. Let's go back to the 4 simplified scenarios, and I've asked our panellists to look at those from their different core expertise and just respond to them in saying, well, where do you think we are? Where are we on this, spectrum of potential futures? Is there possibility to move forward, or are we stuck, or are we just going to keep getting inexorably worse? So I'm going to start with Sandra to give us her thoughts.
Thanks, Jodie.
On where we are.
Yeah. So I'm a bit of a pessimist, so I actually think we're closer to number 3, the Heartbreak Hotel one. So with some aspects of 2 and the odd aspect of 4, considering we have HPAI sort of floating around and we really don't know what the consequence of that's going to be. So when Jodie sent this, I saw a list of less than optimal outcomes, but also thought this is really human health focused. So on their expert panel that did this, I don't know where the animal health people were, because research we did during COVID was quite, with vets, talking to vets about what was happening, what they were doing, it was quite clear that there was some quite significant animal health and animal welfare issues that were a consequence of the public health interventions and other things that were going on during COVID, like sick people not being able to look after their animals, all sorts of issues. So So that sort of points to that interdependency that we talk about in One Health, that animal health, human health, environmental health are all interdependent. So my other thought when I saw this is my perspective is it's actually a consequence. Any of these scenarios aren't perfect, and they're a consequence of larger, higher level problems. It's not they're immediate problems, but they're not what's the driver of these things, what's actually behind them all. And because I work in One Health and we're talking about One Health, it's a complex problem that needs a holistic sort of response. And so the fact that we're thinking about these means that what's happening at the higher level, or this is our experience, what's happening at higher levels isn't as effective as it should be. So there's lots of positives. We've got greater understanding of One Health now, greater government buy-in, as we can see from the funding for the AIID and also the One Health division of the new interim Australian CDC. But there's still a long way to go, isn't there? And there's still a lot of fragmentation between sort of different One Health initiatives, which we may talk about later. But my perspective of how do we get out of this is, yes, we need to address some of these immediate problems, but we also need to tackle what the root cause and the higher level causes are. And hopefully that will facilitate an environment where we can move back towards a much happier equilibrium for everybody. So there's a number of things when we think about that lovely figure from the One Health definition that Jodie put up earlier. That's, if you're a visual person, I find that really helpful because it sets out really nicely that you've got the animal, human and environmental health sectors and disciplines on one side and you've got the community on the other. And one of the huge issues that has come out, like at the Global Health Security Conference that I was just at in June, and also a webinar on HPAI I was at this afternoon, organised by Public Health Association of Australia, was the whole issue about miscommunication and disinformation. And in my mind, part of that is because when we think about between those two, the society and human, animal and environmental health, there's those little cogs with communication, collaboration and all that in that. And it's basically a gigantic communication and relational breakdown, isn't it? That we've lost the trust and we've lost the pathways of communication with society. And so how do we regain that? And that is basically we have to rebuild those relationships with society, which means engaging them in what we're doing as One Health practitioners. So when we talk about that, well, we're not, I think the other thing as scientists, we're very clever. Like we all know we're clever, and so, but we're not clever at everything, and so we do need to engage with people that's what they're trained in. They're trained in communication, they're trained in marketing. How do we actually claw this back and develop good science communication skills and bridge this gap? The other thing that's really important is how do we establish a strong One Health workforce, because inequity and miscommunication between sectors and disciplines is also an issue. And so we need to think about, well, what does that look like? How do we get equitable input and representation of stakeholders? How do we understand each other, what each other sector and disciplines do? And that's all to do with building relationships and understanding and exploring each other's skill sets. And it's also thinking about, when we're thinking about disease, like infectious disease is on the table today, it's not just about thinking about the disease, even though that's the focus. So when we were talking about this in a group before when we were talking about what we're going to talk about tonight, that, like, I sort of reflect back to being a veterinary clinician in that I always thought about it's not just the dog on the table, it's a dog that may have a disease, but that dog is part of a family, and that family is part of a community, and that community is part of a bigger region. And so while our focus as researchers is often quite narrow on a specific disease or something, we still need to think about that within the context of a bigger picture, and I hope that that's something we don't lose in our narrow focus on developing a vaccine or worrying about how do we approach this and manage this disease, in that we've seen during COVID that public health interventions, whilst they certainly saved a lot of issues for us in Australia, there was other consequences that we haven't completely explored, which then also leads to the role of social scientists. And anyway, so there's a lot of things to unpack, isn't there?
There's a lot in there, and
Yeah.
I'm sure you're all writing down questions because there'll be
Yeah.
a lot to come back and discuss. Thanks, Sandra.
Yeah.
Catherine, I'm going to turn to you now. So where are we?
Yeah, so I'm a little bit different to Sandra, although I do agree with many of your points. I think that we're probably in scenario 2. I looked at the final point, point 10, and compared that with scenario 3. So I think we're verging on scenario 3, but I do feel that we're just keeping up as humanity. I don't feel that we are at a point of collective failure and we're playing catch up. So they were the sort of the points that distinguished for me that we're sitting currently in scenario 2. I love you, I hate you, but we are verging into scenario 3 because we have seen, for example, the healthcare system has globally struggled to keep up with surges in infections. And we are seeing in my field of climate change that the fight against climate change, or I would say the way we're developing solutions for climate change, I would frame it a bit differently, is not where we need it to be. And we are increasingly facing pressure to rapidly adapt and rapidly mitigate, especially for a country like Australia. In terms of the scenarios as well, I think that the greatest uncertainty, and as academics we love uncertainty because we can keep requesting funds to measure different types of uncertainty, but I think it is around governance. So many of these things can often have technical solutions, but the world as we're seeing it at the moment is really unpredictable, uncertain. It's devastating what we're looking at in terms of our global governance systems. And we're seeing trust is mentioned in these scenarios, and I think we all are probably going to make mention of the importance of trust and the rapid lowering of trust that we have in our governments. The other point I noted out of these scenarios is that they all assume that our economic systems stay the same. There's no pushback in terms of, well, do we want to keep pushing our economic systems to grow and to grow and to grow? Do we want to continue producing and consuming? Do we continue to think that the GDP is the gold standard measure of global achievement? So I think that there are deeper questions that we need to consider as we work all together, and we all have a role to play in this. Questioning the structure of our systems and asking those questions about how we do measure our well-being. And we know that there's been some movement in many countries, and Australia has just started this discussion too, around the well-being economy. So that was one thing I really took from this when I reread it today, was it's just assuming we're following the same economic structure. Yeah. So I think a couple of other points as well. With these types of scenarios, they're really interesting to read and to consider sort of intellectually and theoretically. However, it's important that we do start to test these, and we can do simulation exercises to test these sorts of scenarios as well, and to check or to assess what we might call in climate change, the adaptive capacity of different systems to respond to all of these different threats and stressors, as we'd also call them. So we know that many countries have done this in their pandemic preparedness planning, for example. I was involved when I had a brief stint in pandemic preparedness back in about 2005, I think, in Cambodia, supporting the Ministry of Health to develop their pandemic preparedness plan. And we did this sort of, we call it war game. It can be called war gaming or stress testing, but we did see or what happens when the airport is shut, when the roads are closed, when there's no system for, cold chain support and security and so on. But as we all know, and Jodie, you're very familiar with this, we just have not done that stress testing of all these different scenarios in the way that we need to. So that's my first point around these scenarios. The other point I'd make is that given I am more of an optimist than a pessimist, because without optimism, where do we get the energy and the hope to take the action we need? And especially working on these issues, these global challenges, I feel we need to have a sense of hope and optimism that we can make a difference. And in that regard, the role of universities is just vital. And so given the chaos that we see in these scenarios, that we see in our current state of the world, the multiple crises, we're not dealing just with one crisis, we're in a period of polycrises, and the lack of trust in governments, universities are more important than ever to show our leadership and to show that our research is policy relevant and, crucially, can provide some level of hope and optimism. And that we are a place of solutions and where interdisciplinary minds can come together. So I also was prompted by these scenarios to think of the critical role of the universities, also in terms of our current and future students. We have an ethical responsibility to teach both the depth of disciplines but also the breadth. And these sorts of topics cover the breadth, I do see, so that students, they graduate with their eyes open to the world and the challenges that we're dealing with. But they're also equipped with inquisitive and solutions-focused minds. So that is no easy feat. However, I do think we need to challenge ourselves in the way that we are supporting our current and future students. And then finally, or maybe I already said finally, but really finally, part of our role is recognising our place in the world, our place as Australia in the part of the world we are, in the Indo-Pacific. And again, a responsibility to support the capacity and capability of our neighbouring countries, of our friends in the region. And if we go back to my area of climate change, we know that climate change won't bring anything particularly new or different, but what it will do, it will amplify current burden of disease. And these are often fundamental issues in many of our neighbouring countries. This is water and sanitation issues, food security, basic health information systems. So how can we, as a university and as a broader community, really support the strengthening of health systems with a climate lens? And I do think we also have a responsibility as a country to, given we are a leading emitter of greenhouse gases, to demonstrate our commitment to climate action. So those scenarios prompted a lot of thinking for me, Jodie.
Yeah, thanks very much, Catherine, that's great. I'm now going to move to Alicia.
Who really wishes that she brought notes so she could be quite as eloquent as you were just then. So apologies if I waffle. Yes. So I think I've got a bit of a different lens. I'm a very technical person. I'm a very operational person. A lot of my job is we are looking for pathogens or we find pathogens and then we need to generate information to enable people to make decisions. So we did that, or I did that, during the pandemic, and I'm doing that again now for Mpox, and I'm doing that again now for JEV. And I'm doing that again now for a lot of different viral threats that are emerging at once. So I always like to, I think somebody on the panel spoke about this the other day, there's all these threats, polycrisis. You know when you watch a movie and there's like the hero and there's all these people who are going to try and fight them, I always see that the bad guys, they nicely wait their turn, then the hero can fight them all off. We are not dealing with that with viral pathogens at the moment. They are all coming at us at once. Nobody's waiting their turn. Nothing's polite. And for example, at the moment, there's been a declaration of a public health emergency of international concern for Mpox. It is the second declaration for this same virus in 2 years. It is a different form of the virus that has prompted this second declaration. And there are lots of questions people have about this virus. We are being asked here by our public health department, if we have a case and we generate a sequence from that case, where might this person have picked up their infection? Now that seems like a pretty simple question to answer, you would think. When we try to answer those sorts of questions, sometimes we can talk to the person that has the infection. If we can't, we tend to look at available data that other scientists have generated and shared to enable us to contextualise the signals that we're seeing. So in 4 years during the COVID-19 pandemic, we generated 20 million genomes of the virus, which on that scale is unprecedented. We've never done that for any pathogen before. There are 10,000 mpox genomes that are currently publicly available. This virus was first detected in people in 1970. And the form of the virus that we're really, really concerned about, clade 1, that's the one that's prompted the second public health emergency of international concern. I think in 2024, 600 genomes have been generated. So we generated 20 million SARS-CoV-2 genomes in 4 years. This year, to date, we've generated 600. So when people are asking us questions around where might this have occurred, does this look like anything we've seen before, it's really difficult to answer because if the information doesn't exist, we can't answer those questions. Now that's all right for us because we're here and we don't have any cases of clade 1b yet, so we're okay. But people that are trying to develop vaccines, make treatments, do all the sorts of things that people that are experiencing this disease need, they need information. If this information isn't being generated, they can't do that work. And so I think when I think about these scenarios in that context, this is how I think about them. And probably because of that, I feel like we're sort of in scenario 2.5. So I look at equality and access to care and also surveillance and the dearth of information that we have for some of these newly emergent pathogens that is existing that actually limits our ability to respond to this effectively. And all of this is connected. All of it's connected, as we've all said already before. So clade 1b that's emerged now, previously you needed zoonotic contact to acquire this infection. It's adapted. It's adapted now that you've got human-to-human transmission. And it's not the only pathogen that we're seeing that with. So it feels like this is a human emergency, and we're looking at human samples, and this is a very human-centric approach, but it's only recently become a human-centric approach. Prior to this, there was zoonotic contact that was needed. And if we think about the other public health concerns that we've got here, but are also occurring within our region, we've got mosquito-borne diseases. So we've got mosquito-borne diseases here that we have emergence of that we haven't had for a number of years. It's happening in our region. And as climate continues to change, different mosquitoes populations can move, they can flourish, they can cause disease in susceptible populations that didn't have it before. So this approach, even though I suppose I look at this from a very human health-centric place, we've got an imperative working in this space to work better across our different disciplines and actually come together because we don't have a lot of One Health surveillance programs that exist at the moment. We've touched on highly pathogenic avian influenza. If a case of highly pathogenic avian influenza was detected in a person in Australia at the moment, then we could do that. If we wanted to test something like a wastewater sample to see if we had highly pathogenic avian influenza in a population, we can do that. How it came to be, what might be carrying it, are there any hosts that we're unaware of? Is it in livestock? Where is this coming from? We don't have the capacity to answer those questions, not in a routine surveillance type framework. We're reactive. If we see something, we then try and find something, but we actually don't have an established framework to enable all of those disciplines to come together to actually monitor what's going on with these pathogens. We respond if they rear their head up, and then when it's gone away, that all tends to fall away as well. So I suppose that's the lens that I'm looking at these scenarios in. And I'll stop waffling without my notes now, I'm sorry.
Very unwaffly, Alicia.
Okay, good,
Very
thank you.
erudite.
All
Thank
right.
you. Yes. And last but not least, the one man on our panel.
Yeah,
well done,
yeah,
Suman,
I know.
representing your side.
I made it.
Yes.
Yeah. Thanks, Jodie, and good to be here. So, look, I think when looking at these scenarios, it is an appropriate time, 4 years since the onset of the COVID pandemic, to think about where we are. I think we've all been through the ups and downs, but my first response to the 4 scenarios, and they're very, cheekily named, it really depends on where you're at, depends on where you live, or perhaps more so where you were born and the determinants around you. Here in Parkville, we're probably edging towards 2. There's not much I love you, it's more I hate you in terms of COVID, but we're not really seeing strong impacts across society, etc. We're moving forward. Burnett, where I work, has permanent offices in a number of places in the region. So if you're in our office and one of our staff members in Papua New Guinea, you're probably in number 3. Our offices also in Vanuatu, Myanmar, are getting hit a bit harder by other threats and risks, such as climate, such as conflict. And they're not direct links, obviously, to COVID, but they're intersecting risks, as Catherine, Sandra and Alicia have all indicated. So we're not seeing very linear one-way issues that have just got a neat solution and then off we move. And then if you're a truck driver, a sex worker, or a farmer living in West Africa, you're probably in number 4 because you've then got Mpox affecting your family. You've got Marburg, which has emerged in Rwanda, another viral hemorrhagic fever. So these things are getting worse, and they're getting worse. And the next part is going, why are we here? Why is this all happening? And one of the reasons is environmental. And the intersection between environment, animals and humans is fundamental to this. So we're all here talking about One Health because we're trying to address things at a much higher level. We're going upstream to the problem, and that's really the only way to try and solve it. Equity, what I started with, has to be baked in at the centre of that response. If we don't think about those who are left behind or the weakest links, we're not going to respond. That was very much a catchphrase, but we really failed at that in the pandemic. So COVID, at the moment, 27 million excess deaths are estimated from the virus. There's long COVID that's got millions and millions of cases that are still growing as an issue. It's another health challenge along with many others that we're facing, but many systems can't cope with multiple health challenges. And sure, it's not acute, it's not overwhelming hospitals, but it's adding to the burden of illness across the globe. I think also that with COVID-19, talked about the economy. So we talked about the global impact of the pandemic. It was a catastrophic event. We had a $20 trillion hit to the global economy. If you don't care about equity or people, and you care about finances, it was a disaster, right? And so everything must go into prevention and really upstream because we haven't got the systems in place, we haven't got the governance, and we haven't got the equitable solutions to actually address future threats. So that's why people are coming together across institutions, coming together across disciplines. And for me, an example is at the Burnett, we're now focusing on air quality because we recognise that airborne transmission and threats, a lot of people who have worked on this for a long time, are really fundamental to taking away some of this risk of broader pathogens that spread in the air. And that's something that, again, may not be an equitable solution if it's only put in place in buildings where people can afford to make changes. But that's one of the other ways post-pandemic where we're working across disciplines, working with engineers, aerosol scientists, public health people, and more importantly, people who are actually at the front of this. So I'll finish by saying community must be at the centre. We talk about it, but it really has to be a wholehearted change in the approach to these wicked problems.
Terrific, thank you very much, Simon. So through the various presentations, you've heard a lot of different issues raised, content, themes. Catherine, you spoke very compellingly about the importance of universities, that we're here to generate knowledge, to train the new generation, to help find solutions to these problems. And obviously we're here under the banner of the nascent Australian Institute of Infectious Diseases, which is a building that will commence, but before it commences, we as a group of scholars are already meeting and discussing things and assembling. So what are the opportunities and ways in which that entity, by bringing together the Doherty Institute, Burnett Institute, University of Melbourne, how can the AIID help to address some of these challenges, and what do you see as the sort of key opportunities and potential? I'll open that up to the floor of the four of you. Yeah, Alicia.
I don't mind starting. So I mentioned just previously that we're obviously all very concerned globally around highly pathogenic avian influenza. And obviously that is something that crosses sectors and disciplines. It involves all of the different sectors and disciplines in order to get a handle on what's actually going on, because if you don't understand something, it's very hard to track and then to stop it. Bringing together partners through the AIID brings together different disciplines, and we've already started to come together to think about how we can actually, in an actual functional and, my brain's escaped me, but we're actually coming together with a tangible project and how we can come together to start to tackle these problems. It's a multidisciplinary team sport. If you don't have a multidisciplinary team, you are never going to tackle these One Health problems. So in conjunction with the CSIRO and a whole host of different key players in this field, we're actually coming together to think about if we were to tackle surveillance or standing up a surveillance system for highly pathogenic avian influenza in Australia, while we're still in this phase that we don't believe that it's here, while we need to keep an eye on what's actually going on with zoonotic influenzas and importations and things like that, how would we need to assemble this? What would we need to build? Who do we need in the room? And by bringing together these institutions under one roof, it actually enables us to work better collaboratively to start to answer some of these questions. So that's a project that we're actually starting to try and get off the ground at the moment, because we recognise it's a threat, and we also recognise that none of these institutions, because they exist within their discipline and they exist within somewhat of a silo, are going to be able to tackle it together. So actually everybody coming together represents a fantastic opportunity, I think.
Yeah.
Yeah, Catherine.
I think they're great points, Alicia, and I'd just add, I'd love to see a climate scientist in the Institute in some way, shape or form, or collaborations with climate scientists, because the world is going to look very different in 2040. We are not under business as usual circumstances. We need to be looking at how infectious diseases, in this case, will be projected to change, given changes given increased extreme weather events, for example. Yeah. We know that floods, heat waves, the extreme weather events that Australia faces, let alone the rest of the region, are going to increase in their frequency and intensity. That means that our infectious diseases are going to change. They're going to change their geographical scope, they're going to change their quantity as well. So having an understanding of those projections and what that means for the types of infectious diseases programs that we are co-designing with communities, with other partners, is fundamental to any of our work, because the world will look dramatically different in 15 years' time.
Yeah. Yeah, it's not just about having a bat and a human in the same place at the wrong time, is it? Like, it's about thinking about sort of what was driving that sort of relationship and that event, and that is the whole destruction of the environment and loss of biodiversity and climate, and they're all interconnected and interrelated. So it's I think Catherine also talking about governance, I think given that we've got this opportunity to develop new One Health collaborations, I think one of the things we need to do initially is sit down and think, well, what do we actually want? So it's almost like we need a situation analysis and doing stakeholder mapping and thinking about how do we want to structure the governance, which you've probably done, I don't know, I'm just speaking off the top of my head.
All work in progress.
We can say, oh yes, we're working with animal health and the environmental health, so it's One Health, but is it really One Health? So I think part of that is we need to actually work out, well, what do we want and what do we actually mean when we're talking about One Health? Identify what strengths we have, and we've got a lot of strengths. There's some amazing research, like I heard Michelle Wilde this afternoon talking about her HPAI work from the AIID, like just phenomenal cross-disciplinary, transdisciplinary work that she's doing. So we've got lots of strengths. We've got this organisation, we've got a One Health with a lot of sort of fight. We got this One Health department within the CDC. But how do we capitalise on this in an area that is sort of, on one level, not really highly resourced? So thinking about our opportunities, thinking about our strengths and weaknesses, and thinking about how do we get representation of all relevant stakeholders to give that diversity and equity within it. And that is, again, going back to how do we opening up communication pathways, getting people like knowledge brokers who can sort of cross disciplines, like you've got people, like I've got a human health degree and an animal health degree, because I've also got a public health degree. So that sometimes you can be talking about the same, sort of using the same lingo, but you're not actually talking about the same thing. So I think that's helpful to have those sort of people in the room. And also, the problem that one of you, I think it was Alicia, was talking about, that funding, or maybe this was in the webinar this afternoon, the issue is with funding is how do you get One Health funding when we have like the ARC and then we've got the NHMRC And if you sort of talk about animal health, if you're putting in an NHMRC grant, well, they don't want to know about you. If you talk about human health in ARC, well, that's not real good either. So where do you go for One Health funding? And that's also an issue. So there's lots of those sort of things. So how do we plan around that? How do we advocate before we actually get the organisation up and running to mean that what we do is going to be effective? And then once it's happening, what evaluation framework are we going to use? How are we going to monitor the One Healthiness of what we're doing? And that's really crucial as well. So,
Thank you.
I'll keep it short. With the AIID, I think it's a building, it's a facility, it's going to be state of the art. But already just by having that concept and that vision, it's brought people together to start tackling these problems, as Jodie and Alicia have said, particularly around one, evaluating where we've been at with the pandemic and putting forward that thinking. And it is bringing together experts that may work together, but actually it fast tracks that, where we can work together with climate scientists, lawyers, engineers, and also in our own health areas of bringing together the lab to the public health and from the global to the local. It's a very exciting opportunity and prospect to actually continually trying to break down these silos, and you actually need a silo building to do that, it seems. But having everyone under one roof is a first step, but it's more the thought leadership and the discussions that will come out of that's already happening, which is very exciting for actually making or operationalising the One Health approach. Because it is an approach, it's a different way of thinking. You've got to not just stay in your lane, you've actually got to challenge yourself to tackle the bigger problems with others.
but it's also not saying that we don't need silos. Like someone I interviewed once called them silos of excellence. And you need that, don't you? You need experts, and you don't want to just, we don't need a bunch of people who have generic skills, but you also need people with a more holistic outlook that are sort of overseeing what's going on in the silos, and then they know who to talk to and they know how to connect people.
Yeah.
And networkers are sort of really important because they're the ones with the big picture understanding and the systems thinking understanding.
So we've just got a few more minutes before we go to the floor with questions, but the other slide that I've just popped up here as another sort of focus of attention. So, we had those forward-looking scenarios. We did our own kind of rating of, where's the world right now from our own perspective. But just released in the last week or two is the Global Pandemic Monitoring Board's 2024 report on the state of the world's preparedness. And this one they've called The Changing Face of Pandemic Risk. And I've just popped one infographic from the report up there, and you'll see that they've taken a very One Health approach to defining our preparedness, because they've thought about this across the domains of social, technological, economic, environmental and political preparedness, and used that to think about the impact of drivers on global pandemic and epidemic risk in the current climate, based on expert analysis and the Global Pandemic Monitoring Board, which is a group of experts that convenes annually. And there in shading, they've talked about the impact on risk of different drivers, with red being the colour of the apocalypse at very high, and amber is high and yellow is moderate. I don't think anything is a low risk, so that's always a bad sign. But if we look at the highest risk things here, we have, I guess from left to right, agricultural practices and farming, and we've talked a bit about what's underneath that before we met in here. We talk about trust, which has come up already. We've got global movement, and we've got misinformation as the kind of red drivers. And I was a little bit surprised, I reflected to Catherine, climate change comes in at amber. So, I think there's probably a few provocations in there for the panel, but would anyone like to kind of reflect on how you see this risk assessment at the present time from your own sort of domain knowledge, or whether there's anything else you'd like to pull out of that figure and highlight for the audience?
I'm still trying to digest it. It's quite, there's a lot there, isn't there?
There is a lot there. I mean, this is probably a 60-page document, but the infographic is the summary. Yeah. But it's just a way, I guess, of thinking about how all of these different elements intersect to relate to risk.
I think it's a really good way of thinking about it. So what we were talking about with these intersecting risks is they're there and they're big. Some of them are small. I guess the other point is if it's a small risk, it can still intersect and amplify, right? And they're the ones you can't predict. How can a conflict on the other side of the world affect a supply chain, which can then result in something else? And then, so there are things that are hard to just colour code and say that's high risk. But I think one of the points is that it's all, none of it's green, and
Yes.
there's a lot of domains there. And I think the solutions that they put forward, I think, were just kind of threefold. They'll basically work together and collaborate, take a One Health approach, work very upstream on prevention. I think we focus a lot on response. That's how we're sort of geared. But we need to really go as far back upstream as we can for prevention, which is where some of this environmental degradation, where you're getting more pathogens spilling over. And I'll probably just finish with that example where if we go back to SARS-CoV-2 causing COVID, one of the papers this week was around how you might implement a One Health approach compared to a siloed approach. And it was talking about one of the drivers of the virus at the moment is transmission back to animals. How there's been high levels of human transmission. The virus goes back to animals such as the white-tailed deer, and then that goes back into humans potentially. So it requires a very different approach to tackle that. And when they modelled the different approaches, having a One Health approach where it involves getting people from all those sectors working together to put in place interventions like vaccination or changing farming practices, etc., has a bigger impact. So I think for me that's an example of how to think about that. And I did say that was my final one, but I will go back to the equity issue, because that's equity and trust are really central to this, and they are really difficult ones to challenge, and they must always be put forward as the first thing.
It's interesting, the status of misinformation, and that is very, very concerning. We know that manifests itself in so many different parts of our lives, whether it's politics, whether it's general decision making, whether it's climate change, of course. So that makes me very concerned that was rated at the highest level. I suppose it's not a surprise, because we do know the impact that misinformation has on people in terms of their agency, in terms of their ability to make appropriate decisions. But yeah, that for me is a red flag. Yeah.
And it's a big equity issue. People have access to, accurate, culturally appropriate information in their own language. That's a huge element of that as well. Yeah. Any other reflections?
Just to echo what the other panellists have said so far, I mean, I guess to touch on my previous example with the amount of data that's available for SARS-CoV-2 and Mpox, a paper was recently written, and I think it was put into a pretty high impact journal, and it was basically calling scientists saying, this can't be all you've got. People have to be generating data. People have got to be generating Mpox data. People have got to be sequencing this virus. This is a call to scientists to share your information, because without sharing this information, we won't advance. We won't advance what we know. And all of that gets back to all the things we've talked about in a really small scale, but it amplifies on the big scales that we're talking about. Funding. Scientists need funding to do their work. Scientists often hold on to data so that they can then publish it in a good journal, so that they can then apply for a grant, they can get funding to do more work. And so there's a lag between when they generate their information and when it gets out there. But that lag means that in the interim, we're living in a black hole. We don't understand what's going on during that time. So all of these issues affect all of these different things. And so that was just my comment on all of these big things, back to that little tiny example, but it's all interconnected.
Can I add a comment, actually? What is interesting is that having an image of these issues that in a separate way like this is actually not the reality we live in. And so we know that communities are now facing not just one risk. So if we look at communities in northern New South Wales that went through the horrendous Black Summer fires that I think we can all remember, despite them being displaced significantly by COVID when it did arrive a few months later, and then floods, and then they had, it was either a mice plague or a rat plague, I can't quite remember, they're probably both as bad as each other. Right,
It's a
mice,
plague.
yeah. So it's the compounding and the cascading combination of these risks as well.
You get to choose your adventure. They all come at once.
Yeah, and then the lack of time, or the lack of energy and the lack of resources, or the pressure is a better word, for communities to build, recover and, regain their sense of place and, quality of life and health and well-being. So I think that that's the bigger picture we're also looking at the moment.
Look, some of it is also like some of these things like the agricultural practices and farming, well, that's sort of depends where you are globally, what's happening. There's been a sort of shift. Like I'm not in the agricultural area particularly, even though I'm a vet. I came out of companion animal practice, but the fact is, like there's been increasing desire for chicken meat, which is why we've had the sort of quite big rise in chicken populations, and possibly is that linked to the transmission of HPAI. But some of it that is driven by, like some of the issues with agriculture is driven by human greed and sort of wanting more of everything, but also the fact that things aren't being rectified is also political will, or the willingness to put money into modifying some of the bad agricultural practices. So we need protein sources, but then how do we do it? Why do we allow sort of high product intensity farming that is much more risky? Like there's a lot of sort of issues in that to be addressed, but I don't think you can categorically say all farming is bad, but there are bad farming practices that we need to manage better than what we are. But there's also, like, it's not just animals, it's also cropping, the fact that they're like bulldozing forests and things like that to put in, like, grow palm oil and things like that. So it's not a straightforward thing, just going, oh, it's all agriculture and farming. So I think that's a big package to unpack.
It's like Catherine questioning our global economic systems.
Yeah.
There's bigger, broader issues there. Yeah. Thank you. That was, a nice unpacking of some of the key issues there. It's now the time to hear from you. So for those in the room, we have a roving microphone for your questions. Please wait for the microphone to come to you so the audience joining us online can hear. So that just allows everybody to participate. So if anyone would like to start, we can start with questions in the room. And I also have some questions that have been pre-prepared from people who've registered. And we're inviting more questions in the Q&A box online as well. So we'd love to hear from you. This is where the roving microphone gets fit. Well done.
Thanks very much.
Thanks,
it's always good, I think, to undertake reflective practice. So as part of a teaching team of One Health at undergraduate level, we try to practice epistemic humility. And I think we've got 3 doctors, 3 infectious diseases physicians, 1 vet and 1 policy expert on the panel. But the environment, the zoologists are not represented. So how do we see the challenge in modelling our own behaviour of overcoming what is a weakness of a lot of One Health, which is really who speaks for the environment and for the wildlife, as opposed to being preoccupied, as we are in this faculty, with human health.
Anyone like to take that question? Clearly, in a
I've got a
multi-system-
conflict of interest because I teach with those guys.
Go on then, Sandra.
It's a Dorothy Dixer.
That's one of the big problems, isn't it? That that led to a lot of, historically, One Health was the whole Manhattan Principles in 2008 was driven by the environment sector, amongst others. And so it wasn't that the environment and ecologists weren't engaged in One Health from the word go, but somehow things didn't quite go the way it should have, and then we've rebooted with the Berlin Principles in 2021, I think, whenever they were published, around that time, during COVID. So we've now got the quadripartite. So look, let's hope that it's a new beginning and that we do we're steering the ship in a different direction, and hopefully we are going to get more engagement with the environment sector. And part of that is, again, us building relationships strategically, like we do have to with other sectors, like engineers talking about ventilation, like social scientists. We need to, and this is part of us developing good structures and thinking about what do we want, what sort of One Health workforce do we want? It is finding those people and seeking them out and talking to them and getting to understand their skill sets. And look, there's been some fantastic research. There was that amazing paper that was published in Nature that was by Peggy Eby and Alison Peel and Raina Plower-White, and that research group that looked at the Hendra spillover events and found a really strong association with sort of degradation of various flowering plants that the bats feed on, and then when there was a bad climate event and there wasn't as much flowering, the bats sort of fragmented, bat colonies fragmented, and you had more of a risk of a Hendra spillover event. So that sort of gave us a really strong association and virtually showed causation of something that we all knew was true, that environmental degradation precipitates, puts us in a position where you're more likely to get a spillover event. So that's been a group that has got a really collaborative, cross-disciplinary, transdisciplinary approach, because they've got this phenomenal ecologist, Peggy Eby, who's had records over years and years and years that precipitated being able to write up that research. But we, as people who are saying that we're One Health practitioners, we need to seek out our environmental friends. So
just a quick response.
Engage them.
Yeah, I mean, it's okay. Yeah, sorry. I mean, I think that comment's really welcome. I think when you go through a change journey, you're always going to have to find new ways of working together and have that call out. So part of adopting a new approach or readopting One Health is really the centrepiece for pandemic responses, is to say, are we actually adopting that approach? Have we got the right people in the room? And that's a reasonable call out to make every time we do it. We do that for many issues. We do it for gender, we do it for diversity, and we need to do it with our disciplines as well.
Yep. And it's why we need to keep evaluating what we're doing to see actually, are we drifting or are we still including everybody?
Or as you said, is it needed, right? Some things can be siloed, or some responses.
Just great question, Ken. Where are you?
Yeah.
So just an example, the work that I do is a lot of it is supporting policymakers in countries in the Indo-Pacific to develop their health national adaptation planning processes, because adaptation to climate change is more urgent than mitigation, given the very small proportion of emissions that are produced by our neighbours. And all of the work that we do, it's always in a team, it's always with the Ministry of Environment at the table, the Ministry of Agriculture, Water, Women's Affairs, disaster management organisations. It is that intersection of different ministries and disciplines. So I absolutely agree with your point, to be able to move ahead with the urgency that is needed on all of these issues, then we must take an integrated understanding and approach. And I know you do that in your teaching.
I'm going to take an online question and then come back to an audience question, because we have two audiences here. So this one's quite interesting from an organisational perspective. So in a constantly evolving future, how do we recommend undergraduates, in my case biomed into med, can create a foundation of learning to best prepare themselves? And maybe I'll come back.
They can just go and do our courses.
Do you see lectures changing to accommodate One Health principles, or would you recommend applying ourselves to hands-on experience? So this is a challenging thing, like what's the pathway to here, which I think is an interesting question for academia in general.
Well, we teach two undergraduate One Health breadth subjects through Melbourne Veterinary School, AIID, and the School of Global Health Management. Is that right? Have I got the
population.
Yeah, population health, thank you. Can always get it wrong. And I think that's really valuable in that in the level 1 subject, we introduce them to transdisciplinarity. We get them to try and think about how they may in the future work in a way that isn't siloed, that they need to think about the bigger picture and what they're doing. And then the level 2 subject, we teach them systems thinking and using One Health problems, which is not a bad way to approach One Health. So that's our little sort of enterprise at the University of Melbourne. Please recommend that your students come and do our courses because we think that they do provide a really good introduction. But it's as far as in disciplines like medicine and vet, the curriculum is so jam-packed full that there just isn't, everybody says there's no room for anything else. So I know that One Health, I'm pretty sure One Health's listed in the day 1 competencies for vets, but I don't know whether there's any mention of it in the medical registration or medical requirements, medical education requirements. So do we need to start advocating a bit louder for that as well, and also across science disciplines and make it a bit more formalised? Do we need a network of One Health academics?
New pathway.
Yeah.
All right. I'm going to go to a question in the room. Thanks, Sandra. Back here. Thank you.
I think Catherine raised a very important question, and that is whether the economy has to grow. And for me, that's the elephant in the room, global capitalism. And there are voices out there, usually not heard in universities, that are saying that we need to move beyond capitalism and move to an alternative world system based on social parity and justice, deep democracy, environmental sustainability, and a safe climate. Vandana Shiva in India refers to such a system as Earth democracy, which is similar to the notion of planetary health. I'm of a camp that refers to it as eco-socialism. Whatever you call it, I'll throw the question back at Catherine, do we need to envision an alternative to the present global economy? And what kind of vision do you see?
It's a simple one. I thought I threw that out to the audience rather than it coming back to me.
I gave you an idea.
We're already seeing some governments, as I alluded to, moving in that direction. I cannot see an enormous shift away from capitalism. However, we can reconsider what we value and how we value it. So this is the concept of the wellbeing economy. We're seeing that in Wales, that's having a massive difference in terms of intergenerational justice. There's really great examples of where all sorts of important issues are included when it comes to the Treasury deciding on whether to prioritise a particular policy. So there's a consideration of environment, there's a consideration of social issues, there's a consideration of intergenerational justice. We see that also in countries like Bhutan, who have their great gross national happiness system, and I've had the pleasure to work in Bhutan with the WHO, and it sounds, I don't know, I mean, many of you would be aware of that, it sounds quite a lofty, how on earth does this even operate? But the people who work in the gross national happiness division are the most qualified and intelligent people in Bhutan. That is the place where the graduates want to work. Bhutan is an incredible country in terms of the education system. The graduates are incredible. And it's a country where that type of integration of all these other considerations when it comes to making policy decisions happens, and it works really well. There's a checklist, it's quite long, it's more than 4 or 5 issues, it's about 20 or 30. We've got here, as I mentioned, the Treasurer Chalmers launched the Wellbeing Economy last year under the name of Measuring What Matters. And this is a work in progress, I'll put it that way. It's based on work that the OECD has done recently, but it doesn't consider, to the degree it needs to, environmental issues. It doesn't consider justice to the degree it needs to as well. So the discussion is starting in Australia around alternative ways of measuring wellbeing, not just looking at GDP. But I think there has to be encouragement from us to our policymakers and our politicians that these sorts of ideas are, I can't believe I'm saying this, but might pass the pub test. So, because otherwise, we already saw the Treasurer being knocked down, being talked about as a hippie because of these sorts of concepts. So how do we almost give permission to politicians to think about things more laterally, to think about things that have justice at their core? That would be my response. But others might also.
I was going to move on because there's a lot of questions here, so I'm deliberately giving everybody a turn. So, but one of them comes back to the fundamental issue of trust, and we know trust is multidimensional. There's trust across different sectors of society and institutions and so on. But how do we, as universities, what's our role in helping to build public trust as organisations and as individual academics? Do we have any thoughts about that? Go, Suman.
I think twofold. One is the science and the research around trust misinformation and how to actually combat it as an actual issue, because it is a technical issue that can be vaccinated against and mitigated. The other part is from a community and an institutional perspective, really. I think that's a key thing out of the pandemic. We've got some important health communicators on the panel and here on the stage throughout the pandemic, and it was an important role. And I think a lesson out of it is that how do we do that better the next time around, where we actually have experts up front, and the corrosion of government trust is a big negative consequence. We don't see it so much in Australia, but you look at the US, you look at many other states, and it is a huge global problem that bleeds into anti-science, and then that again cascades. So it definitely needs to be tackled again from institutions like universities in a systematic way.
Okay.
I think you can also start small with that as well. Not necessarily small. Small is the wrong framing for what I'm about to say. But I know at the Doherty we have a community advisory board, and it's comprised of members, key community leaders that come and they may have a question. And based on the question, different scientists from the Doherty come and talk to that group. And so there's a particular question I spoke to them a little while ago around respiratory viruses and SARS-CoV-2. And it was a forum for members of the public who are not scientists to come, ask their questions, very safe space, no questions were off limits. And then the goal of that is then they would take that back, and then they would take that back to their communities and people that they talk to, and that would actually be a source of information directly from scientists. And it's initiatives like that, I think, as well. We tend to think about this on a really grand scale, but we also can start on maybe a more one-on-one specific scale in order to do that. And I think that's a really fantastic initiative, and some of those are in place. And from what I understand, they're working quite well. So that's another.
Terrific. Thank you. Any more from here? The roving mic is roving. Yeah, JP.
Thank you. I'm going to start this question with a very short story of Chile, where I was born. In 1960, Chile organized the World Cup. And we didn't have a single stadium to actually organize that World Cup. And the organizing committee went and said, because we have nothing, we want to do it all. And this is kind of the story you see in many low and middle income countries trying to implement One Health, because they don't have these stiff frameworks of human health, animal health, environmental health. They are keen to do everything they can to actually have a proper implementation of One Health. But sometimes they fail, not because they don't have the willingness to implement this, just because there are funders with very clear objectives on what they have to do in country, because certain countries want to support certain things and not others. And therefore, the agenda is coming from other places, not where the needs actually exist. So I wonder if, with your expertise working in different low and middle income countries and your different experiences, whether you have any ideas or recommendations on how to actually contribute to implement One Health in these places where actually we have the problems of climate change and the most severe effects, where we have emergence of infectious diseases, where we don't have proper surveillance systems, we have food insecurity in these countries where we have, which are mostly prone to conflict and fragility in general.
I was actually thinking that a lot of I've been involved in some project work in Southeast Asia, and I often think they do One Health better than we do because they're low resource and they've got to be innovative, and there's a lot of really interesting grassroots sort of One Health initiatives, like vets in sort of small, who are like city vets in smaller areas who develop relationships with their human health colleagues, and then they've got their human health workers doing passive surveillance for African swine fever and things like that. So they sort of take advantage of things like opportunities like that. I think we're sort of a bit more resistant to One Health just because because we're more set in our disciplinary silos. I don't know.
I'd probably come back to one of Jodie's opening points, that this isn't a new concept.
No.
And
No.
if we look to our Indigenous friends and colleagues and those with local knowledge, and learn and listen and be patient, and the answers are generally always there. It's I think the Western model of evidence development and understanding can often get in the way of realising that many of the solutions are actually either in place, or they were in place perhaps 50 years ago and hadn't needed to be in place until another outbreak of that type. So there's also that legacy of understanding and that legacy of Indigenous knowledge. So I'd suggest that it's again, reiterating your point, it's not a new way of understanding the world.
We've just kind of woken up to it.
When you hear like Cam Raw, who works at the uni, and other Indigenous colleagues talking, it's like they see health as a holistic thing. They don't even divide it into human, animal, environment health. They see it as a more holistic sort of entity. And so I learnt more about One Health working with colleagues in Southeast Asia and talking to people like Cam than sort of doing research in it specifically in some ways. Like it's more about, like I've learned a lot doing the research, but also just learning about the actual practical, how do you do it? That's what's important, isn't it? Like it's all very well having the head knowledge, but then how do we actually apply it and how do we implement it? And how do we implement it across the whole system, not just thinking about governance, but thinking about, well, how does that governance impact what's happening at a grassroots level? So...
And some of our questions here that we've already received have kind of unpacked that too. It's like, how do we do this when we have different definitions of health in different sectors, or how do we set goals and objectives that will map across all of the sectors? So, you know, it is this challenge that we've made this divide, and now we're trying to unpick it in finding ways that we find shared objectives or aligned goals or a common understanding of that health across sectors, which is now our problem to unpick. Yeah. No, I think that's reflected there. Any other questions? Yes, please.
Thank you. My name is Monica Nolan. I work with WHO on wastewater and environmental surveillance. I was struck, Jodie, by the scorecard that you put up, which showed governance in the lowest, not green, but moderate, given the global failure to negotiate a pandemic treaty, amongst other global failures. And I was just struck by some of the comments around governance, and I was interested in panel reflections around governance, including the points that have been made about getting the right stakeholders and interdisciplinary considerations in the room, but also in the context of dynamic threats where you need different people in the room if you're considering something like Mpox or something that's threatening our poultry industry. And I was interested in how you see governance as well as the appropriate agility to look at situational leadership.
I can start. Thanks, Monica. I think governance is one-on-one often, but I think reflecting on the question before as well, when you've got dysfunctional systems or a lack of governance, you can't actually often solve it through that. And I think from the One Health side, there's so much informal or either trade or health care or etc. that needs to then be, you need community systems that are functional as well as the formal system, which can be part of good governance and recognising and adapting to that. I think the pandemic treaty was also another key thing around how to do this. I mean, One Health, All Hazards, a fundamental part of the pandemic treaty, and it's still alive in the next 12 months. Australia's got a key role in trying to negotiate and take that forward. It's going to be a longer process. It might be like a climate process, but which is not winning either. But I think it is fundamental because it also addresses the equity issues at a global scale and comes back down to how we, from countries like Australia, help our neighbours. There is a need to look, I've worked with government and also at this donor partner table where those decisions can be made and you can influence things by working across those silos that exist. So I think by influencing the frameworks and the approaches you're going to take, simply by saying we're going to do it at One Health, you will automatically bring together the necessary stakeholders, but it has to go beyond just health departments and environmental departments and into more the community systems as well.
Yeah. And so one of the visions, like from the research I did, was thinking about having this overarching One Health governance that then linked into all the disciplinary sectors, so that you need that sort of holistic view that then feeds in and has communication with health and environment and vet or animal health, because you still need those separate disciplines to deal with disciplinary issues, but you need a coordinating body. And like my hope will be that the new Australian CDC, that is actually what's going to happen. Let's watch this space to see whether it does. But that would be the ideal, wouldn't it? But we've still got to convince the government, because when the government sort of decided to sort of let's have a CDC, they whacked it in the Department of Health. Well, there was logistical reasons for that possibly, but like it's made certain things sort of more difficult than they maybe should have been. But let's see what happens, and let's just hope that we do end up with some sort of good One Health governance.
And there's lots of issues of trust in that room. Yes.
One comment on that too. I mean, I think what happened during the pandemic and what we witnessed was we witnessed a staggering amount of red tape being cut to achieve things that we had never done before across all the different disciplines and sectors. It was staggering to see what can be done when people are strongly motivated to do those things. And some of those things were good and some of those things are bad, and we're not talking about whether they were good or bad, but we did and achieved things that I don't think any of us in all the disciplines that we work in would have thought were possible prior to that, in the time periods that things occurred. And I think since then, for the different viral threats that have emerged that certainly we're dealing with here, we are very responsive, and a lot of the lessons that we learnt seem to be fading a little bit. And I think the governance, to give us the ability to be agile for those threats, we need to start working on that now. We don't work on that when we're in the middle of a crisis, because none of the crises will be of the magnitude that enabled us to cut the red tape that we lived through during the pandemic. Hopefully we're not in that scenario again. But I think there's a lot of work that people are keen to try and do to work out those issues now, so that when we need to come together, hopefully we've actually got a structure that enables us to do that, because we are extremely reactive, I think, and that's not the time to be trying to work out governance issues, because everybody's all distressed and it's just not good. But I think that would be something that we need to work on in peace times. Think about trying to bring these things together rather than when we've got a crisis.
Yeah, I think that's such a great point. And towards well, when was this? Maybe late 2022, the WHO released its manifesto for a green recovery. I don't know if anyone saw that. It didn't actually get a lot of press, but it was actually linking the COVID recovery to a just transition away from fossil fuels. And to see the WHO in its leading role in terms of global governance advocate for that so strongly, in that document anyway, was quite an important shift. I think also one other comment just quickly on governance, and it brings in a couple of the C words that you had on there, coherence and collaboration, is around donor coordination. And particularly outside of Australia, this is particularly important, where we're seeing a lot of different funding sources come in for One Health and also for other challenges like climate change. And to what extent is there the collaboration and the synthesis of these different projects actually making a difference? So a lot of the time we do see not enough of that coherence and that collaboration, and that's got a lot to do with the way decisions are made and the governance structures as a whole.
Right. I think that was our final question. We had many more questions online. I do apologise to people online that we weren't able to get through them all, and also some of our pre-prepared questions, but it's been great to have the engagement in the room and to hear from our panellists. In addition to our expert panellists tonight, we're lucky to be joined by 3 researchers from AIID Foundation partners who are working on One Health related projects, and they'll be at the reception just after this event to talk to you about their work, and obviously you can talk to any of the panel members if you still have burning questions. But we'll be delighted to be joined by Associate Professor Ash Hark, who's the Dame Kate Campbell Fellow at the Department of Microbiology and Immunology at the University of Melbourne. Dr. Juan Pablo Villanueva Cabezas is a research fellow in One Health in epidemiology at the Peter Doherty Institute, and Joanna Fraser is the Arbovirology Working Group Head at the Burnett Institute. So please do come and talk to them about their research projects. Our reception will actually be upstairs, but you'll be guided to the reception when you leave. But in closing, please also take a moment to share your feedback on this event via our short survey. We're always keen to improve what we offer to you, and you can access that through the QR code on the screen. So please just take a moment to take a photo of that, and we're really keen to hear what you thought of us tonight. And once you've all taken your photos, I'm going to wait for you to take your photos because you've got to link to the site first, but then you've got hands free to please thank me, our panel who've done a great job tonight, and we've been really engaged, and it's been great to have that conversation with you all. But Professor Catherine Bowen, Associate Professor Suma Majumdar, Dr. Alicia Arnott and Dr. Sandra Steele. Thank you all so much for coming.
Thank you.